Okay, the phones are almost done dialing, so we are going to go ahead and get started with our content today. Good afternoon and welcome to the Madison VA Hospital's live teletown hall. Today, we're excited to provide you with an update on the recently released market assessment recommendations that were sent forward to the VA Asset and Infrastructure Review, or AIR Commission, just yesterday. For those of you who haven't heard of the market assessment process or the AIR Commission, the recommendations to the AIR Commission provide a roadmap for the future infrastructure for our VA here in Madison and across the country. The goal of this project is to make sure we have the right services and facilities available to meet your healthcare needs into the future. So after we discuss the recently released recommendations to the AIR Commission, we're going to provide you with a COVID update and then conduct a general question and answer session where we can take your questions live here on air. My name is Abe Rabinowitz. I'm the Assistant Director here at the hospital, and I'll be moderating the call. Today, we're fortunate to have a panel of Madison VA's leadership team here to answer your questions. This includes Chief of Medicine and Infectious Disease, Dr. Chris Cernich, Chief of Specialty Nursing and our Vaccine Coordinator, Christy Esch, our Deputy Chief of Patient Administration Services, Liana Torres, and our Chief Social Work Service, Stephanie Schultz. So we hope that you stay on the line with us this afternoon, and we encourage you to participate in the live question and answer session that will follow. If you'd like to ask a question, all you have to do is press 0 on your phone, and you'll be connected with a staff person who can take your question and get you into the queue to speak with our panel. You can still listen to the town hall while you're on hold as well. And you can begin to call in with your questions now, and we'll hold and begin to answer them after the announcement section of the town hall. If you do get cut off, unfortunately, there's not an easy way to rejoin, so please stay on the line. If you do get disconnected, please know we post these recordings to our internet site so you can listen to them afterwards. So we'll start by just saying that these town halls provide a great forum for us to talk to many of you about all of the important things that are happening at our hospital and clinics. And today we have a special initiative to discuss: the results of the recently completed market assessment process and referral of recommendations to the National Asset Infrastructure Review, or AIR Commission. For those of you that are interested in reading this report, the full report is available now online at www.va.gov/AIR Commission report. And it's important for us to begin to explain this process with talking about how it started. When Congress passed the VA Mission Act in 2018, it required that VA undertake an asset and infrastructure review process. This process requires that VA study the current and future healthcare needs of veterans across America and evaluate VHA's healthcare infrastructure, our medical centers, our clinics, and all of our buildings to ensure that VHA staff have the resources needed to continue providing veterans with world-class access to care and healthcare outcomes. The idea behind the process is that it will build a healthcare network with the right facilities in the right places to provide the right care for veterans in every part of the country, that it will strengthen and continue our partnerships, that it will continue our world-class academic training and research partnerships, and it'll put our direct care healthcare system on a sustainable path, ensuring we remain the primary world-class provider and coordinator of veterans healthcare for generations to come. As part of this AIR process, VA will submit recommendations to the presidentially appointed AIR Commission, which just happened yesterday. That AIR Commission will review the recommendations before presenting their findings and decisions to the President and Congress in early 2023. So a little background on the process. The consultants who did the market assessments and came to these recommendations completed them by specific areas in the country called markets. There are 96 defined markets across the country, and most of our area is in the central market of VISN 12, which encompasses the catchment areas of the Madison and Milwaukee VA facilities. So I'm going to give a brief overview of the project and then provide a review of the recommendations for our facility here, and then discuss the planned next steps. So first, and again, studies like this are necessary because it's critical that we have a capital plan to ensure our buildings and infrastructure keep up with the changes to healthcare demand. VA has buildings that date back to the Civil War, but the majority of facilities were built in the 40s and 50s. And our own facility here in Madison might not look like it, but it was built in 1951. And obviously, since 1951, the delivery of healthcare has changed drastically, as have the needs of our patients during that time. So it's critical we keep up with the necessary maintenance and infrastructure improvements so that we modernize our facilities for the healthcare services available today and tomorrow. The AIR process aims to address VA infrastructure concept in the most comprehensive way since World War II. So yesterday, the recommendations from the market assessment reviews to the AIR Commission were made public and are published in the Federal Register. This recommendation delivery step represents a culmination of 4 years of work. So we'll discuss the recommendations today, but that's just the beginning of this process. Now that the recommendations are with the AIR Commission, that commission will review the recommendations, analyze them to ensure that they meet our required criteria, discuss them with the public, visit sites, meet with our partners, and listen to our veterans. We expect that process to take approximately 1 year into early 2023. For most of VHA, in the near term, the recommendations will have no major infrastructure impacts. In many cases where major construction is required, changes are 10 to 20 years away. The recommendations were developed with this question in mind: what should our system look like to best meet the needs of veterans now and for generations to come? So the consultants conducted extensive data analysis, verified its validity with VISNs and medical centers. They reviewed where veterans are and forecasted where they will be in the future. They looked at care that has been delivered and projected how much will be needed into the future and where. And then they looked at the community's capacity and quality of care. And then finally, they looked at VA's infrastructure and identified its needs. They've been reviewing this data with the field for the past 3 years, and those data reviews form the basis for their recommendations. During their site visits and after, VISN and medical center leaders and planners were consulted to think through the nuances of planning in the regions where the data might not illustrate fully or clearly the needs of the population or the area. And they also incorporated input from veterans. All of the recommendations made to the AIR Commission had to meet 6 criteria. They had to address the future demand for care, ensure access to care, focus on the impact to the mission, ensure that that's not compromised, quality of care, cost effectiveness, and sustainability. So now that the assessment recommendations are public, we want to review with all of you what is recommended for the Madison VA. And there are 2 principal recommendations for the Madison VA. The first recommendation is that we modernize our emergency department. And for some time, we've known that our emergency department is in need of modernization and expansion. So this recommendation is already included as part of our strategic capital plan, and we've been working on options for implementing this improvement over the next several years. So what they recommended is something that we have been planning and agree is something that's needed for the Madison VA. Second, they recommended that we establish a new community-based outpatient clinic in East Madison. This is also something that we have been planning to do and is already in progress. And we're very excited to be able to bring more access to care for veterans on the east side of Madison. The new location that we're planning will be off of U.S. Highway 151 near the UW Health East Clinic and American Family Insurance campus. We are expecting to break ground on that clinic very soon and are planning for a grand opening in the spring of 2023. So again, the new CBOC in Madison, in East Madison, is something that's in progress and underway right now. So if these recommendations are approved, and again, they're already in progress for us here, they will become mandatory actions the department must pursue. And in our case, as I mentioned, these are already in progress. These are things that we agree are important for Madison VA, and we are excited to implement. The market assessment recommendation also includes what they call complementary strategies. And these strategies, if approved, would move forward as additional discretionary actions VA anticipates taking to enhance the AIR Commission recommendations. The complementary strategies included in the report are, first, that we expand home-based primary care coverage to the Rockford, Freeport, and Janesville CBOCs. So this recommendation, again, is in progress as part of a national geriatrics extended care expansion project. So we're already looking to expand those services to the southern tier CBOTs for Madison VA veterans. The second complementary strategy is to improve inpatient medical, surgical, and mental health bed availability by identifying a distinct bed or service location to support detox patients. So this, again, has already been identified as a need by our clinical leadership and is something that we are pursuing to help make sure we have that capacity for care here at the Madison VA. The third complementary strategy is to develop a facility master plan for the Madison VA. So these are essentially strategic space plans that are conducted periodically to ensure optimal use of available space. And for those of you very familiar with our hospital, we have every incentive to try to make every inch of useful space here in our hospital effectively used and managed. So this, again, is something that we have in the queue. We have a capital project in place that is scheduled for award this year to develop a master plan. Again, we are in concurrence and believe this is a great idea for our facility. The fourth strategy is to recommend that our market be realigned. So our vision submitted a recommendation to realign the definition of healthcare markets so that instead of Madison and Milwaukee being a distinct market, that Madison and Tomah share a market, and that Milwaukee and Iron Mountain share a market. So this redesignation will more accurately reflect the referral patterns that we currently manage with Tomah patients coming to Madison for their complex care and Iron Mountain patients going to Milwaukee. So this was also endorsed and something that we believe would improve our ability to plan into the future. And last, they recommended that we seek partnership with federally qualified health centers to the southwest of Madison. So again, we are aware of a need to offer more services for veterans southwest of us, and we're going to continue to pursue options for delivering care to those veterans closer to their homes. So those are the recommendations that the AIR Commission will be reviewing for the Madison VA Hospital and Clinics. And as you heard, most of these recommendations are already in progress. So we do not expect a lot of change from this process. We like to see it as validation of the strategic direction we've been taking over the last several years, and it means that we really don't predict any potential for significant disruption or changes to the services that you've come to expect here. What comes next is a year of review by the AIR Commission. So recommendations are just that until fully approved, and they'll spend the next year reviewing the recommendations for Madison, but for all of the VA hospitals across the country. And as they conduct their review, we'll keep you updated on their progress, and we do expect stakeholder reviews and other open forums for them to hear veterans' voices and make sure that those voices are heard. In summary, veterans are always at the center of what we do. This whole process is simply attempting to ensure we have the most up-to-date infrastructure to support our staff to be able to do what they do best day in and day out, and that's to provide quality and compassionate care to our veterans. And we wanted to use this time today to make sure that we had the opportunity to talk through these recommendations with you directly so that you could hear them from us and so that we could answer any questions that you have. So we'll just pause for a second and just see if there are any active questions that anyone on the line has about the AIR Commission process. Okay. Right now, we are not seeing AIR Commission related questions. So what we'd like to do next is to move on to our COVID update. If you guys, any of you have joined us for Teletown Hall over the last 2 years, you're probably familiar with our Chief of Medicine and Infectious Disease, Dr. Chris Cernich. Dr. Cernich has been a regular on these calls. He's provided incredible service to us and to all of you as our clinical subject matter expert on COVID-19. So Dr. Cernich, we'll turn the floor over to you to provide a brief update on where we stand today.
Thank you, Mr. Rabinowitz. So the good news is that we have seen a major drop-off in COVID activity. We are approaching the lowest rate we have observed since the alpha wave, which, for those of you keeping track, was kind of in the early to late summer period when we bottomed out, and everybody was optimistically hoping that we were through it. And then Delta came, And unfortunately, we had our Omicron wave quickly on the heels of Delta, so we did not get much of a reprieve after the Delta wave. And to be perfectly honest, nobody knows what the future holds. The bad news is I think we are seeing some troubling signs that we will probably see at least a modest fifth wave as we get into the late spring, largely driven by Omicron 2.0, or what is referred to as the BA2 variant. Many European countries are starting to see their case rates climb and their hospitalizations rates climb as a result. And some of you may have seen the news that wastewater surveillance, which often correlates well with COVID activity in communities, at least in a third of communities, wastewater surveillance has shown an uptick in counts. And a lot of the mathematical modeling that's going on by public health authorities suggests we will see case rates rise sometime in April or by early May at the latest. As has been the case all along with COVID, a lot of caveats and uncertainty to go along with those statements. The U.S. population has a high degree of immunity, both through a combination of vaccination and getting infected. And we have seen that individuals who have high degrees of immunity through primary vaccine and boosting, or vaccination plus infection, does provide high levels of protection against the more severe complications of COVID, specifically hospitalization and death. I think one of the unknowns here is whether we will see variants that have sufficient immune escape that leads to a breakthrough in those more severe outcomes. But all the data that we have, particularly with the Omicron 2.0 variant, is that individuals who have been vaccinated and boosted, or infected and vaccinated, will have very high degrees of protection against the more severe outcomes, with the caveat, if you're immunosuppressed, that may not be the case, and that's something that we would encourage anybody who's receiving chemotherapy, anybody who's receiving immunosuppressants, or who has a health condition that leads to immunosuppression. Make sure that you're talking with your providers to kind of get a plan for what to do when we see waves. And the reason why I make that recommendation is we are seeing a lot of relaxation of the non-pharmacologic interventions, and it's not clear to me whether we're going to see those re-implemented with subsequent waves. And so I think if you're in one of those categories of patients who's immunosuppressed, make sure that you're having a conversation with your healthcare provider to have a plan. There are therapies that are available for those with severe immunosuppression that can do passive immunization, and we've been doing that at a very high level at our VA already. We have treatments that are available if you get infection, and so having a plan for how to get tested and to access treatment quickly is something that I would advise to all of our veterans. And then having those conversations, when do you need to be putting the mask back on as an individual, which is something I have not yet given up because I work in a hospital and I want to make sure that I'm not coming in and spreading it to my patients and to my colleagues. So where case activity is currently in Dane County, I'm not quite ready to ditch the mask, although we're getting close, and certainly I will consider it once we get into moderate or low activity in Dane County. We're just not there quite yet. So my big recommendations at this point is, if you have not gotten boosted, make sure you get boosted. The data is very clear that is what you need to protect against the more severe consequences of COVID. If you've had COVID, we know that vaccination on top of COVID does protect against infection and more severe complications, although I will be the first to admit that it's not entirely clear how many vaccinations you need on top of infection. Right now, I think we're recommending following the vaccination series, but there is some data that suggests that a single mRNA dose after infection is sufficient. So something, again, to have a conversation with your provider. And my other caution is if you've just gotten by on infection for immunity, there's a lot of variability in there, and I would strongly advise you to consider getting vaccinated in those situations. And beyond that, I think it's important for you to understand we as a healthcare institution are looking at these data very closely. Given a lot of the uncertainty, we do not anticipate major changes to our masking policies in our clinics and in our other healthcare areas. So I know many of you are in communities where masking has essentially gone away. Just remember that we're going to be asking people to continue to wear masks given the high degree of uncertainty. We are going to, for the foreseeable future, be strongly encouraging all of our veterans to get vaccinated. The other big area of uncertainty is what do we do for kind of regular, does this become an annual flu shots? Again, nobody knows right now. I would anticipate that we will see some regular boosting being offered, whether that's every year, every 2 years, or some other interval. Your guess is as good as mine at this point. So just show some grace to your healthcare providers and your healthcare institutions. There's a difference between what is recommended out in the community and what is recommended in healthcare facilities, and I just want to make it clear that for at least the near future, we do not anticipate significant changes to our COVID precautions because despite the good news that we're seeing right now, we probably can expect to see some waves, although I hope those waves will continue to get lesser and lesser in severity. And I think that that's a reasonable prediction that the waves will become less and less severe. We just don't have a good crystal ball to say when we get to the point that this becomes just like the flu. We're not there yet, but we're getting closer to it. And I'll stop there.
Well, thank you very much. It's good to have at least a cautiously optimistic, but definitely optimism because the numbers have been going down, but also being very cautious because one thing that we've learned about COVID over the last 2 years is that it always throws us another curveball. So Dr. Cernich's recommendations about being careful in your communities, being conscious of where you are, those are still things to consider. Certainly supporting vaccination and boosting. And we mentioned the vaccine hotline number before, but I'll mention it again now here. If you need to get vaccinated, or if you want to get vaccinated, or if you have questions about getting a booster, you can schedule a vaccination appointment with us at any time. You just have to call us at 608-280-2160, and we have those appointments here at the main hospital and all of our clinics. Dr. Cernich also provided us with a really nice reminder that even though mask mandates are generally not enforced in communities, here at our hospital and clinics, it's really important that we continue those protocols. So please do know that when you present to one of our facilities, you will be asked and expected to wear a face covering, and that just protects everyone in our hospital and allows us to make sure that we're sustaining care, keeping our staff and all of you free from infection. So why don't we go to see if we have some questions from the audience. Okay, the first question comes from James Rutch. James, if you're on the line, can you ask your question?
Yeah, one of the biggest problems that I see with myself and other veterans is one of the biggest roadblocks we have is to getting good quality health care is the hours of operations of the clinics. A lot of times if we hold down jobs, the clinics are closed before we can even get there from off of going to work. So my question is really, do you see any time in the foreseeable future of extending the hours of operation to maybe maybe 5 p.m. or something of that nature?
Yeah, I think, James, what you struggle with is what a lot of us, who get our health care in the private sector struggle with, which, is that clinics and hospitals generally have business hours that are consistent with many of us that have full-time jobs, so often have to use time off of work in order to come to their appointments. I don't know that we have any immediate plans to extend hours of our clinics. But what I will say is that these are opportunities for us to hear your voice and your concerns. So while we don't have any immediate plans to make that available, that's certainly something that we hear and certainly something that we can consider. So we really appreciate the call and your question. Christy has one other thing to add to that question. Go ahead.
The other thing I'll add is that, our providers offer phone and video visits too, so I know sometimes just taking the travel time out of that can make it a little easier to work in, and most of our issues and concerns can be addressed through those types of appointments too, so never hesitate to ask for something like that, if that would work.
That is a great suggestion, and one of the things, we always try to find silver linings in things, and one of the things that's changed for us over COVID is the expansion of telephone care and virtual health care. So if that's something that might interest you, that certainly would be something that we can offer during the day, which might not require, as Christy mentioned, the transition time to come to the hospital or clinic, and it's something that you can do just from a private space with your phone. So that's a great additional suggestion, Christy. Thank you. The next question that we have is from Alfred from Reedsburg. Alfred, if you're on the line, go ahead with your question.
Yes, sir. My question is, with the price of gas now, is there any chance that Congress will reevaluate the gas mileage going to your VA appointments for the people that get gas mileage? I mean, you've got people coming from Rockford, people coming from various other places. Is there a chance that they'll up that? Because you're talking most places over $4 a gallon, possibly $5 a gallon here soon. And I know for me, it takes me maybe half a tank of gas to get from my house to the VA. And if I've got 2 or 3 appointments in a week, so I'm just wondering if Congress is going to reevaluate the gas mileage for us.
Hi, this is Liana Torres. I'm the Deputy Chief of Patient Administration Services. I hear your concern, and I definitely empathize with the situation because we're all going through it. At this point, we have not heard that the mileage base used to reimburse travel-eligible veterans is going to be changed. As soon as we hear that it's going to be changed, we will probably use one of these platforms to inform veterans of that change. And I would like to also make an announcement. We want to make an announcement to introduce our new beneficiary travel system that will automate and streamline both filing a travel claim and payments for travel claims submitted by veterans who are travel eligible. This system is called the Beneficiary Travel Self-Service System, also known as BTS3. This secure claim system is completely electronic, meaning veterans and caregivers no longer have to fill out a paper claim form to mail or drop off at the travel office. Claims can be filed anywhere at any time from your personal computer or smartphone to submit your claim. This system will automatically calculate mileage base and provide real-time reimbursement amounts, including deductible, list all past filed claims and statuses to track for payment, and electronically certify claims for submission, just to name a few benefits of this new system. We encourage veterans and caregivers to create a new, their BTS3 profile by going to Access VA or by calling the travel department at 608-256-1901, extension 12224. Again, the number is 608-256-1901, extension 12224. Thank you.
Thanks, Liana. And Alfred, to your question, I mean, that inflation is something that we're all feeling the pressure of. And obviously there are a lot of very dynamic situations that are happening in the world right now that cause that. So we're all very sensitive to those increases. But as Liana mentioned, there is no, we don't have any specific information about Congress looking at legislation to increase those prices, which is not to say it couldn't happen, but we don't have any current information on that. One other thing to keep in mind is if that you are concerned about commuting costs to come to the hospital, as we just discussed, virtual care through your phone is certainly a great option for avoiding all of that driving and being able to communicate with your provider through VVC or the telephone. And then for those of you who do still come to the hospital, what Liana mentioned as far as the new beneficiary travel reimbursement system, please do take time to check that out. That automates a lot of the paper claims. It helps our processes move a little bit more efficiently and will help manage your payments a little more effectively. So we definitely encourage you. I think once you get it set up, which we know has some challenges, it's easy to use once it's able to be set up and operational. So consider VVC. We're all going to cross our fingers that those gas prices stop going up and maybe start going down. But VVC is a great option for veterans who are concerned about the mileage reimbursement and the cost. Okay, our next question is from John Passawall. John, if you're on the line and able to ask your question, please proceed.
Yeah, I actually have about 3 questions. The first one is they're talking about improvements in the Madison area, and I live out in Beaver Dam, and it's about 40 miles or so. We have a clinic here. Is that going to affect our clinic at all?
The first answer, your first question is no. There are no plans to make any adjustments to the Beaver Dam clinic other than to offer more services. We recently just began offering physical therapy services in Beaver Dam, and there's nothing in the recommendation that asks us to change the location or mission of any of our community-based outpatient clinics. So the new clinic on the east side will be another option for veterans on that side of town, but it will not replace the Beaver Dam clinic.
Great. Next question was, I do all of my medical through the VA. I use the clinic, and if I come down for major things, down to Madison. Also, there are times when if I do have something major, like I did have a surgery, I use the community care or the choice program, which worked great. Now, with the new services and such that are going on in Madison, will this be affected at all?
Hi, this is Liana, and I'm the Deputy Chief of Patient Administration Services. So your first question in regards to Medicare, we always advise veterans to learn their VA eligibility and co-payments in different services, and then you have to make your decision in regards if you're signing up for Medicare or not. We're not Medicare advisors, so we can't advise you on that. We can advise you on your VA eligibility. In regards of your the choice program, so the choice program ended in June 5th of 2019, and we welcomed Mission Act in June 6th of 2019, which it's similar with different eligibilities. And in regards to that, if if at the time there's a new clinic and it changes the distance, the travel distance, the travel time from your residence to that place, then your eligibility for the Mission Act to receive services in the community paid by the VA will change as well. So at that point, then you will have to evaluate what your eligibilities are. Now, keep in mind that just because the Mission Act provides the funds for the VA to pay for the care in the community, is still VA. The VA is the one that authorizes that care. So if we can provide the care, we will provide the care. In times when we cannot, or it's not a reasonable distance per the Mission Act, then veterans can be authorized to have the services in the community.
Hi, this is Stephanie Schilling. I'm the Chief of Social Work. I just wanted to add one additional comment about whether or not you should sign up for Medicare. Social workers are available at the hospital and in the clinics to help you kind of look at your situation and decide and help you decide and make an educated decision regarding your Medicare and other benefits that you might be eligible for. So I would encourage you to talk to your primary care provider and ask them to hook you up with the social worker at your clinic, and then set up an appointment to talk to them about Medicare and a bunch of different other options and benefits that you might have available to you.
Do we have a social worker right here in the Beaver Dam Clinic, or can I contact one, at least talk to them over the phone in Madison?
Yes, if you want to, you can call the social work office. That number is 608-280-7085. Or if your provider puts in a consult, we'll give you a call over the phone.
Okay. Thank you. That helps.
And we answer Medicare questions all of the time, so it's well within our wheelhouse to help you out.
Great. Thank you very much.
Thank you.
Okay, our next question is from Richard, who has a question about the East Clinic. Richard, go ahead and ask your question.
Yes. Can you hear me there?
Yep, we can hear you fine.
Okay. The question that I had is this new East Clinic. I live on the east side, so it's important to me. Are you going to have a pharmacy out here in the emergency room? And the next one would be, are you recommending having that fourth shot after the booster?
The first part of your question about the East Clinic is the East Clinic will not have an emergency room. So our emergency room here at the hospital is the resource for that type of care. Of course, you can always call if you're experiencing any kind of potential emergency, our telephone triage line, where we have nurses that can answer your questions and advise you about where you should best go if you're having what you believe is an emergent situation. The East Clinic also, at this point, is not programmed to have a physical pharmacy, but pharmacy services are obviously available. And just another plug for some of our electronic technology. If you have an account through MyHealthyVet, that's a very easy way to reorder your prescriptions. So we're trying to replace some of the previously provided physical services with services that you can access over your phone and virtually. And then I'll let Dr. Cernich answer the question about the booster shot.
So, Richard, you're asking a good question, and unfortunately one that I don't have a good answer for right now. So current recommendations for vaccination for people who are not immunocompromised is a 2-dose primary followed by a booster dose administered generally 5 months after completing the primary vaccine series. Those who are immunocompromised currently have a 3-dose primary series followed by a booster vaccine. So that group already is getting 4 doses of vaccine. I do think it's highly likely that there will be recommendations for regular boosters. Again, as I alluded to earlier, we don't know what that interval looks like right now, whether it's going to be once every year, once every 2 years, or something longer than that. I do know, looking at the data that's available, predominantly comes out of Israel, and they did not find that administering a booster within 6 months, a second booster within 6 months of their first booster did not seem to confer a whole lot of additional benefit above and beyond that first booster. Pfizer has kind of been ahead of the curve relative to Moderna. I know that they have data in front of the FDA that's going to be reviewed soon. So I suspect we will start seeing information coming out from the CDC and other vaccine advisory committees in the next month or so. So I would not be surprised if we see a recommendation for a booster every year. I do not think we're going to see any recommendations for boosters within a year, if that makes some sense.
So just one thing to add, I mean, obviously we're following all of this very, very closely, and Dr. Cernovich knows more about this than certainly anybody else I know. So we keep our ears open all the time, and there are a couple of different ways that we can keep you advised of when these changes happen. One is through forums like this. So as you see invitations to come to town halls like this, we'll share information with you as quickly as we have it about what's recommended. The other thing that we mentioned earlier in the town hall is encouraging people to sign up for our email updates. So one of the things that Christy and the vaccine team have been doing routinely is reaching out to veterans through those email groups where we have email addresses for people to let folks know of what the current recommendations are for vaccination and for boosting. And as they change, inviting veterans who haven't had those boosters to call us and schedule an appointment to get one. So we're trying through as many forums as we can to notify you when there are changes that are data-driven and evidence-based about when to get booster vaccinations. So we'll certainly keep you posted, but please do also sign up for our email updates, because having your email address on file really gives us a lot more opportunity to reach out to you and connect with you when there are changes. So thank you for the question. The next question we have is from Wooten. Wooten, what is your question? Wooten, are you on the line? Okay, not hearing Wooten, I will just read his question. So Wooten asks, I live in Freeport, Illinois, and he'd like to know if we're getting any kind of more comprehensive hospital near Freeport to cut down on transportation to Madison. So Wooten, expansion of any kind of significant medical facility in Freeport is not part of the Air Commission report. But one of the things that we can tell you is that we are doing a lot to try to expand services in Rockford to provide more specialty care, more rehabilitation care, and other services so that it is more convenient for our veterans that are in the northern Illinois region. So please, depending on the type of care needs that you have, keep your ears open for opportunities to seek that care. Closer to your home, but unfortunately there is no plan within the Air Commission recommendations to build additional healthcare facilities in the Freeport area. Okay, our next question comes from Peter.
Hi, how are you doing?
We're doing great.
That's not my question, but how you doing?
It was a good question, though. You made us all smile.
You always ask it. Anyhow, my question is this, okay? I'm going to a Stop Smoking group. I live in Marengo, Illinois, okay? I don't know if you know where Marengo is, but do you know where Nowhere is? Well, we're right in the middle of it, okay? We're basically southeast of Rockford. We got 3 stoplights in the whole town. Anyhow, I go up to Madison to go to the Stop Smoking group. It's a once-a-month thing, and I've been asking this since I joined the group. Why don't we have a similar group in Rockford? All it would take is a room and one person to moderate. The difference for me, first and foremost, it's a 2-hour drive going up, nearly 100 miles each way. The difference is, if I go to Rockford, it's $19 and change. If I go up to Madison, it's $75 and change. So even the government, even though that's very disproportionate to what it is. I mean, here to Rockford versus Rockford up to there is not 4 times as much. Couldn't we have a stop smoking clinic once a month, a gathering? I mean, really the difference is you'd save $60 just on me. I'm sure you can get a person for $60 to sit on a group of grumpy veterans for an hour.
Well, Peter, as all taxpayers ourselves, we appreciate your stewardship over funds. But I'll turn it over to Stephanie to see if she can address the question about that service in Rockford.
Peter, first I want to congratulate you on participating in the Stop Smoking group. I think that is just great for you to start working on that, and I'm really proud of you for doing that. I think your suggestion is a really great idea. I don't know why we don't have a Stop Smoking group in Rockford, but I think it makes a lot of sense, and I'll definitely look into it and try to get something started, or at least something that maybe you can participate in virtually or over the phone, which I know probably isn't the best option. But again, congratulations on taking care of yourself, and I'll definitely take your suggestion and look into it. So thank you.
Great question, Peter. Thank you. Okay, then. We're just looking for the next question here, folks. Just give us a second.
While we're waiting, this is Stephanie again. I know someone had a follow-up question and wondered if I could give the phone number to social work again, so I will. It's 608-280-7085. Or if you're calling the toll-free number, you can ask for extension 17085. So I think I saw a couple of other questions about things that social work could help with. And so if you're having questions about meeting your financial needs, social work can help with that. I think there was a question that I saw about rent. And then again, Medicare and other insurance, if you have those kind of questions, we're more than happy to help you get hooked up with resources.
Thank you, Stephanie. I appreciate that. And thanks to everybody for your questions along those lines, and to Peter for making a suggestion about smoking in Rockford. We definitely want to support that. The next caller that we have is Gary. Gary, if you have your question ready, please go ahead.
Yes, I am a volunteer at the VA in Madison, and I have been visiting patients in the past. Do you have any idea when volunteers will be able to do that again? Thank you.
So, Gary, this is Dr. Cernich. You're asking a timely question as we are actually in the middle of reevaluating our visitation policies. We certainly value or place high value on the importance of visitation, whether it be people that are family members or friends or our volunteers who do a tremendous job here at our facility. And we are hoping to intelligently liberalize our visitation policies. But obviously we need to look at that very carefully to make sure that we're not exposing our patients or our healthcare workers to an increased risk of COVID-19. But we are now at a point where I think we can start to liberalize our visitation, and that's something that we hope to be pushing out new recommendations. I will be honest, I am not sure whether we explicitly kind of paid attention to the volunteer-based visitation, but I really appreciate you bringing it up, and we'll make sure that we incorporate that into our evaluation for sure.
And Gary, just a second that, and thank you first for being a volunteer at our facility. Volunteers do so much to improve the environment of care that we have here at the hospital, and provide such a needed boost to all of our employees and to our patients. So we will look at that moving forward and keep you posted. I think we have time for just a couple more questions. The next question is from Robert, who has a question about the air conditioning. Robert, go ahead. Robert, can you hear us? Okay, well, I'll go ahead and ask Robert's question because it's a good one. Robert asks, since you're talking about another clinic on the east side, are you going to close or reduce services at the west clinic? Please clarify. So that is a good question. So as we are planning to open the east clinic, we will be making the west clinic a little smaller, but we will also retain services at the west clinic. So if you are currently getting your care at the west clinic and you want to stay at the west clinic and not transfer your care out to the east clinic, we want to provide you with the option to do that. So the short answer to your question is the east clinic, yes, will open. Will it pull some patients from west over to east? We expect it will, but we will be retaining primary and mental health care services at the west clinic. Very good question. And I think we have time for one more question. So the final question we have is about vaccines, and I think this is an important one because we want to make sure everybody has the most current information about vaccinations. And the question is from Charles. Charles, if you're on the line, can you ask your question, please?
Yes, I'm concerned about vaccines and boosters because they keep moving the goalposts and the requirements are always changing. I know 2 people who were previously healthy who took the boosters and got blood clots in their lungs and died. Secondly, if I get a virus and I transmit it to another human being, doesn't that change genetically and change the whole process of vaccinations? I also get the best care in the world at the VA in Madison. I'm very appreciative of the work they do, so I'll just listen. Thank you.
Thank you, Charles. This is Dr. Cernich. I think I certainly understand a lot of the frustration about kind of the moving targets, not only around vaccinations, but certainly the moving targets around public health precautions to prevent the spread. When you're dealing with a pandemic like we have been dealing with for now over 2 years, a lot of the information is going to change, and it's very similar to the fog of war that we kind of experience in combat. And so as the situation on the ground changes, we do need to move our recommendations. And I think you're pointing out an issue that is valid, that there were a lot of people holding out promise that the vaccination was the silver bullet that was going to fix all of this, meaning it was going to drop transmission rates to near zero and we could move on with our lives. And unfortunately, the vaccines have not proven to be that kind of silver bullet for protecting against transmission. That being said, I think the data is overwhelming, showing that vaccination reduces severe complications of infection, even more so than we see with other vaccines that our patients willingly take, like influenza and pneumonia vaccine. The COVID vaccines that are available and approved now are extraordinary advances in healthcare. The protection against severe outcomes is 30 to 40% better than what we see for influenza vaccine by comparison. And certainly, I'm not going to be the one up here and say that any therapy that we offer is devoid of any risks. Certainly, there are well-known side effects that we can see with vaccination, although the incidence of those side effects is extraordinarily rare, and on balance, strongly favors administering the vaccine. And so there may be rare situations where certain patients should not receive the vaccine, but those are in the range of 1 to 250,000, 1 to 500,000 patients that we're talking about. So for the vast majority of people, there's no doubt that the vaccine provides extraordinary protection against the most severe outcomes of COVID-19, and as a result, that's why you see 97% of physicians, 95% of nurses that are getting the vaccine. And so I think the science is pretty clear on this, that the benefits of vaccination outweigh the potential harms.
Okay, thank you, Dr. Cernich. And for all the reasons that Dr. Cernich just outlined, are really stand behind why we've been encouraging vaccination and boosting. We appreciate all of these questions. We really appreciate your time. We got some really nice suggestions for things that we can do here at the hospital through this call. We want to thank everybody who hung on the line for the whole time for participating. We will continue to have these kind of teletown hall opportunities quarterly, or if circumstances warrant them, we'll have them more frequently than that. But we really want to appreciate all of you, the time that you took to be with us this afternoon. We wish you all well, and happy St. Patrick's Day this week. Take care, everybody, and thank you again for your time.